The length of rhinoplasty really depends on how extensive we're working on your nose. For instance, if we're doing a closed approach to remove a small dorsal hump, it may take only about 45 minutes to an hour. But if we're doing an open approach with extensive tip work, osteotomies, and putting spreader grafts and tip grafts and so on, it could take up to 4.5 hours. The recovery of rhinoplasty involves where next day ICU and small packing is removed. Around third day or fourth day, the sutures are removed. And by the seventh day, all the cast and the splints are all removed. And you may go back to work and put light makeup on. Some patients may have a slight bruising by seventh day, especially if we did an osteotomy, but most patients, there's not much bruising at all by 7th or 10th day. And most of our patients, by the third week, you may resume full activity. And that's the typical recovery for our rhinoplasty patients. The cost of rhinoplasty really depends on how extensive we're working on your nose. If we're doing a relatively straightforward rhinoplasty with closed approach, such as reduction of a small dorsal hump or limited osteotomy, those usually run about $2,000. But if we're doing a more extensive open rhinoplasty, where the septum is involved, where we're doing tip work, where we're doing grafts, and where we're putting spreader grafts or tip grafts, and where we're doing osteotomies, that ranges up to $6,000–7,000. Now that cost is inclusive of your anesthesia fee, facility fee, and surgeon's fee, as well as all the post-op visits. There are several risks that involves with rhinoplasty, just like any other surgery. There's a small risk of bleeding after surgery. There's a small risk of nasal obstruction, very small risk of septal perforation or difficulty of smell. Now, these are very, relatively speaking, small risks, and about 2–3 weeks before surgery, all our patients are educated with post-op care and instructions to minimize this risk.